So in this afternoon symposium, we're focusing on how and if we can optimize self-management strategies in musculoskeletal pain. And this initiative is actually part of a bigger initiative. There we go. Click on the screen. What do you know? So this initiative is part of an EU supported initiative where we here at Aalborg University have joined forces with several academic clinical in partners from the industry across Europe to try to who together have this ambitious goal of trying to figure out how we best can support healthcare professionals in acquiring and applying evidence-based knowledge regarding self-management strategies. So how can we help healthcare professionals to help patients? But what we're also interested in this initiative is trying to figure out, can we in any way provide evidence-based help, so good advice, support to people who are struggling with musculoskeletal pain, to sort of act as a filter before you enter the healthcare system or need or to seek assistance from your, for example, GP, physio, or chiropractor or alike. And the focus is on musculoskeletal pain problems in our consortium, because it is a problem. If you can talk about musculoskeletal pain as an entity, it is a problem that takes up a lot of space in the healthcare system. So these are numbers from the Danish reality, but they resemble in many ways what's seen across the world. And talking about making space in the healthcare system, it is quite evident that the future healthcare systems will need to have a bit of space to help accommodate the growing need there is in, we see where we're getting older and older, we're getting more and more people that have multiple, both pain conditions, but also other clinical conditions. We can see that this is on the rise, whereas we cannot really see any sort of increase in renewal of healthcare professionals. So the bottom line is pretty much, we need to figure out how we can make space in the future healthcare system. And a lot of the things that have been pointed out by the Danish healthcare authorities recently is that we need to solve future challenges in new and innovative ways. With other words, we need to prioritize differently. We need to, of course, reduce low value or unnecessary care. And we need to take into use, to a greater extent, healthcare technologies. What we also need to do is we need to make decisions in the future on who should we not help as much as we're helping today. And if we're not helping them as much as we're doing today in the traditional way, can we provide our support in any other ways? Because we definitely want to provide good care, but it has to be correct and safe, and it has to be equally as good as the level of care what we're providing today. So this brings us to the topic of self-management strategies. Now, we've recently conducted 2 systematic reviews where we're focusing on spinal pain in the one review, and in another review, we're looking at musculoskeletal pain affecting the extremities. And the common finding in both reviews is that exercise is frequently used as a part of a self-management strategy. But very often, and almost always, is this accompanied by some sort of guidance. So in addition to how to exercise at home or in the gym, how do we cope with pain? How can we change or modify unhelpful pain behaviors or thoughts? So with this in mind, and because we're meeting here in the consortium the next following days, we decided it would be very relevant to put these 2 things into focus before we started our meetings, and which is why we have invited our 2 speakers here today, who will be telling us about how can we exercise, is exercise meaningful in any way, etc. And also we want to look into psychological approaches to help manage musculoskeletal pain conditions. So without using any more words on that, I would like to introduce my first speaker, or our first speaker of today is Tony Elmos Andersen. Tony, he is a professor of pain psychology at the University of Southern Denmark. His primary research focus is on the prevention and treatment of post-traumatic pain, with special focus on whiplash-related disorders. In his work, he tries to map psychological risk factors for whiplash-associated pain, and he has contributed to the development of new treatments for both the prevention and treatment of the condition. So before I give the word over to Tony, I would like to tell you that there will be time and space for a few questions immediately after his talk. But before both presenters have concluded their presentations, we will sort of have a panel discussion at the very end where we will try to sort of, with the help from the experts we have invited here today, to see what are the trends, where are we going in the future, etc. And so feel free to save all your questions until the end. So without further ado, I want to invite Tony to come here. And while I am trying to figure out where his presentation